Hi, I'm Dr. Lorelei Achor. I'm a podiatrist in Southern California. I've been in practice over 20 years, and I'm here to talk to you about peripheral neuropathy. It's one of those conditions that we often see and very difficult to treat, and it causes a lot of frustration and anxiety and pain for both the patient and myself as a practitioner, because it's something we can't cure, but I hope to help them treat. So today we're going to talk about what is peripheral neuropathy, and maybe some ways that we might be able to help patients deal with that a little bit better and maybe even improve their quality of life. There are some new exciting things that we can talk about that may help resolve some of those symptoms. The symptoms, like we studied, can include burning, tingling, numbness, loss of sensation completely, and most significantly, pain. Peripheral neuropathy is basically a situation where the nerves outside of the brain and the spinal cord don't transmit the information back and forth properly. Some of the reasons that people get peripheral neuropathy include diabetes, one of the most common, where patients have difficulty controlling their blood sugar, and the blood sugar can cause damage to the nerves, which ends up in some of the symptoms we discussed. Other things that can cause peripheral neuropathy include medications or chemotherapeutic agents. Certain types of tumors can cause peripheral neuropathy, and again, the drugs that we give them to try to treat these tumors can cause the peripheral neuropathy. So one of the ways we diagnose neuropathy is we take biopsies. And when we take a biopsy and you look at that biopsy under the electron microscope, you can see the nerve and the myelin sheath around it, and you can also visualize the blood vessels that are in that area that help feed the nutrients to that nerve. And under that microscope, we will note that the nerve has shrunk considerably, as well as the blood flow in that nerve or around that nerve. And both of those factors comprise a big part of why that nerve is so painful. It is basically getting choked from getting the blood flow and the nutrients that it needs to be a healthy nerve and function the way it should. So our ultimate goal in trying to help treat peripheral neuropathy, and again, not cure, but treat peripheral neuropathy, and decrease a lot of the potential things that come along with it. The help with the numbness, help with the pain, increase your mobility, improve your quality of life, include basically making that nerve function better. How do we do that? We do that by increasing the local blood flow to that nerve, by helping get rid of the waste and the byproducts of all this metabolism and the nerve functioning, get them out of there, clean it up, let it function the way it's supposed to. But the bottom line to all of this is you just have to move. You've got to get up and move your body. You've got to get those muscles going. You've got to get the blood flow going. You've got to get the lymphatic drainage clearing everything out. You've got to get rid of all of those waste products. You've got to get your blood circulating, and you have to move. The challenge is with peripheral neuropathy, it's often very painful. Just like arthritis, it's very painful to move. But we know that the more you do move, the better you get. So one of our objectives is to help you do that in a way that is less painful, or hopefully ultimately pain-free. I'm really excited because we have a new treatment program to help treat your peripheral neuropathy and get you back to your life. So what are the ways that we can help you get back to your life? Utilizing a new treatment protocol with a device called an H-wave. It does all the things that we talked about your body needing to do: increasing the blood flow, increasing the lymphatic circulation, getting the tissues and things moving. And it's great because it's something you can do at home. You can do it while you're sitting there watching TV. In fact, you can do it while you're sleeping. So I've been very fortunate to see firsthand how amazing this technology has been for several of my patients. I had one patient who came in with his wife and had been for quite a while, basically in tears. He was falling a lot. He was hurting himself because he couldn't feel things. He was in a lot of chronic pain, and he had really withdrawn from his family and his life. And his wife was beside herself. And after putting him on the modality of the H-wave, which admittedly he was not real keen on because he'd tried so many other things, but they were desperate and were willing to try it. And less than a month later, he called me, and his wife called me on the speakerphone, and they were both in tears, but this time tears in a good way. He's back on his feet. He's out doing his walks every day. He hasn't had a fall. And each day he says that he uses this machine, he feels better every day. This is a patient that I saw watched deteriorate before my eyes, and when I see him now, he is a new man. One of the things that I love about the H-Wave is it's virtually pain-free. You don't have any pain with it, which I have seen with so many of these other treatment modalities. It's some patches that you put on your body in specific spots. You turn the machine on, you adjust the frequencies based on what we're trying to treat, and you let it do its job. You can watch a movie, you can read a book, you can sleep through it, take a nap, put it on before you go to bed, and it will do the bulk of the work for you. One of the great things about this modality is it is user dependent. The more you use it in the beginning, the quicker you see the results, the better the results are. And what I have seen with my patients over time is if they make the commitment initially and use it very frequently, then as time progresses and their symptoms dissipate, they have to use it less and less frequency. There seems to be this inverse proportion. The more you commit at the beginning, the better you do, and then we can see this usage time go down and down, hopefully to something that just becomes a maintenance type of dose that you do as you need to, when you need to. Many patients come to me as a last resort. They've seen neurosurgeons, they've seen neurologists, they've seen orthopedists, they've seen their primary care doctor, and they are left worrying that they are going to end up in a wheelchair and not functioning and be in constant chronic pain. Because unfortunately, most of us know somebody who has ended up there. And the biggest thing that I am happy to say is that we've got some options now, some things that weren't easily or readily available to us that are now. And I'm excited to be a part of that. I'm just here because I believe in the product, and I am ecstatic to see what it has done for a number of my patients.